Melvin Jenkins is smiling today, but that wasn't always the case.
I was always ashamed. When I looked in the mirror, my self-esteem was low.
That's because he was missing several teeth, but now he has a full... Melvin Jenkins is smiling today, but that wasn't always the case.
I was always ashamed. When I looked in the mirror, my self-esteem was low.
That's because he was missing several teeth, but now he has a full set of teeth thanks to Dr. Joseph Harmon at Delmarva Dental Services.
All thanks to Dr. Harmon. Dr. Harmon and the staff here has truly showed me nothing but love.
In order to fit Melvin with new teeth, Dr. Harmon had to surgically position implants into his jawbone beneath the gum line.
Kind of like a screw in wood, except the bone grows into the threads, unlike wood.
It sounds painful, but because of 3D scanning, Dr. Harmon says it's not.
We only had a two-dimensional picture of a three-dimensional object, so we had to guess about nerves, we had to guess about sinuses, we had to guess about bone depth, and the 3Ds allowed us not only to view the bone in the patient in 3D, but it also allowed us to have programs that have virtually allowed us to put implants in and turn them different ways and position them virtually before we did the implant placement in the patient.
The process starts with a mold.
We made a mold of his mouth where he didn't have teeth and he has teeth here.
This is where the 3D scanning comes into play. Dr. Harmon scans the mold so that he can have a 3D image in the computer. From there, Dr. Harmon makes wax versions of the ideal teeth to replace the missing teeth.
These teeth, they wax them based on the alignment, and they also wax it based on his bite.
Another scan of the mold is made with the wax teeth.
And that scanned, and that told us where the teeth should be.
Then Dr. Harmon has an overlay made based on the mold and wax teeth.
And that allows me, using a scan of Melvin's jaw, to decide where I'm going to put the implants using a 3D imaging. After I do that, I have one of these made, which is called an implant guide.
The implant guide allows Dr. Harmon to know precisely where to put the implants in the gum so as not to hit nerves. When the original scan was made, Dr. Harmon was able to map out where the nerves are.
How we would do it in real life with Melvin is we would take this guide, obviously would numb the patient. We would take this guide and we would place it in his mouth. And it has the holes you saw. Turn this way a little bit, tilt your the other way. Yeah, okay. It has these holes, and these holes determine, like I said, where we're going to put the implants.
The implants are permanent and are what secure the teeth. That precision allows for a less invasive procedure, which means less pain for the patient.
The process it wasn't painful as I thought it was going to be. I was more excited, I couldn't wait for one step after another step after another step, and they coached me through it, and there was always, after a procedure was done, they always called to make sure that I was okay, and that showed that they're concerned and their love that they have for their patients just as well.
And for Melvin, he's proud to show his new smile.